What's up with people being scared to get the flu shot? I'm going to set the record straight today. First of all, you don't need to be scared of needles. If you have 5 tattoos and tell me you're scared of needles, I'm going to lose it. The flu or influenza is a highly contagious respiratory infection caused by influenza viruses. The influenza virus infects you by entering the body through mucous membranes in the mouth, nose, or eyes. When you have the flu and you cough or sneeze, the virus becomes airborne and can be inhaled by anybody close to you. You can also get the flu if you touch a contaminated surface like a telephone or a doorknob and then touch your nose or your mouth. That's why you gotta keep your hands washed. Of course, the risk of infection is greater in highly populated areas like schools, buses, and crowded urban settings. Most healthy adults may be able to infect others beginning 1 day before symptoms develop and up to 5 to 7 days after becoming sick. In most communities, school-aged children are the first age group to get the flu. Then they carry the virus home into after-school activities where they interact with other kids and people at your house. The flu virus is usually prominent from October through May. The time is typically known as flu season. On average, annually in the U.S., 5 to 20% of the population gets the flu and 230,000 Americans are hospitalized. 25 to 49,000 people die every year from flu-related causes. How do you know if you have the flu versus the common cold? The flu exhibits an abrupt high fever and lasts much longer than a regular cold. Body aches and severe chills are the usual symptoms, and fatigue and weakness are also common. There is no cure for the flu because it's a virus. Now I have to tell you my biggest flu pet peeve. I am so sick of people saying that they got the flu from the flu shot. It is impossible. You guys got to trust me on this one. Sure, you can get a slight fever and body aches after you get the vaccine because that's your body's response as it's making antibodies to protect you from the flu. Anyone who says that they got the flu from the flu shot has never really had the real flu, because if you've actually had the real flu, you would know the difference. We must get the flu shot, okay? Always. So, who should get the flu shot? Everyone 6 months and older should get a flu vaccine every year, and it's especially important that certain people get vaccinated either because they're at high risk of having serious flu-related complications or because they live or care for people at high risk for developing flu-related complications. So here we go. Children younger than 5, but especially children younger than age 2, adults 65 years of age and older, pregnant women, asthmatics, even if your asthma is mild, people with neurologic problems like epilepsy, people that have chronic lung problems or heart disease, anyone with a blood disorder such as sickle cell disease, endocrine disorders such as diabetes, people with kidney or liver disorders, and we can't forget anyone with a weakened immune system due to disease or medications such as people with HIV or AIDS, cancer, or those on chronic steroids. People who are morbidly obese, meaning a body mass index of 40 or greater, should also get the flu shot. Other people for whom vaccination is especially important are healthcare workers and people who work with any of the above high-risk groups. If you are a healthy person between the ages of 2 and 49, there's an inhaled vaccine option called FluMist for those of you who don't like needles. It's also a great vaccine and readily available. So who should not get the vaccine? People who have a severe allergy to chicken eggs, people who have had a severe reaction to an influenza vaccination in the past, children younger than 6 months of age. Influenza vaccine is not approved for use in this age group. And if you have a fever, you should wait to get vaccinated until you're well. Also, people with a history of Guillain-Barré syndrome should not get the flu shot. I sincerely hope this can be the last word on flu for my entire community, and please get vaccinated. It's the best thing you can do to stop the flu. Always keep it healthy with your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.